everyone. Good morning. Welcome to Zomeo Classroom. I am Dr. Tarana Malik, and this time I have come with something different. In this session, we will be discussing a clinical condition and then taking up a case related to this condition. We will be talking about cough. Now, cough is something that is very common. It happens to almost everyone at some point. And as physicians, as homeopaths especially, we get a lot of cases of cough in all age groups. So let us have a look at what is cough, what causes cough, how can we correlate the clinical presentation of cough with a diagnosis, and also how can we use this clinical presentation in finding a remedy that we can give to the patient. So let us begin. Now, cough is a sudden and a repetitively occurring reflex which is actually helpful. Cough helps us in clearing large breathing passages from secretion, from irritants, from foreign particles and microbes. So in a way, cough is actually a protective reflex. So how do we differentiate between different types of cough? Or in other words, how do we classify cough? Now we can classify cough according to its duration, character, quality and timing. The most common classification that we must do in cough, because this type of classification will also help us in arriving at a diagnosis. This is based on the timing on cough. We differentiate cough into acute, subacute or chronic. A cough is acute if it is present for less than 3 weeks. A cough is subacute if the symptoms have been present between 3 to 8 weeks. And generally, any symptom of cough present for more than 8 weeks is associated with chronic cough. Secondly, we can also differentiate cough as dry or productive, as in dry cough where we do not have any expectoration or secretion of mucus, and productive cough where the patient complains of expectoration. Let us have a look on what causes cough. Now, before we move on to the causes, we must understand that even though cough is most commonly associated with the respiratory system, it can also be because of a cardiac cause, a gastrointestinal cause, and other non-specific causes which are rare. So let us have a look at each of them and understand what sort of conditions can be involved. Now, the first and the most common cause of cough is infection. Now, amongst infections, viral infections are the most common reason responsible for cough in people of all age groups. So, in cases of adults who have had cough for more than 8 weeks, we then suspect something beyond viral infections. So, the cause of a long-standing cough in most cases could be a post-nasal drip, could be underlying asthma, eosinophilic bronchitis, or gastroesophageal reflux disease. Amongst infections, we have common cold as the most common cause. We have acute bronchitis, we have pneumonia, we have pertussis, and lastly we have tuberculosis. In most cases, if we are dealing with acute cough which has lasted for shorter than 3 weeks, we must think of common cold and a viral infection. But again, in India especially, we must also consider tuberculosis when we are investigating a case of cough, as it is very common in our country. After a respiratory tract infection has cleared up, the patient can be left with something called as the post-infectious cough. As the name suggests, this type of cough lasts even after the infection has cleared up. Now, a post-infectious cough will typically be dry, non-productive, which does not produce any phlegm or mucus. The patient will tell us that he experiences tightness in the chest or a tickling sensation in the throat, which triggers the cough. And post-infectious cough can be present usually even after weeks of the illness. So what happens in cases of post-infectious cough is repeated coughing further aggravates the inflammation in the airways, which leads to more coughing. Typically, a post-infectious cough does not respond to conventional forms of treatment. So it is very common for the patient to tell us that he has tried various common medications for cough, but still there has been no relief in his symptoms. Now, continuous inflammation of the airway could also increase sensitivity and may aggravate existing issues like allergies as a cause of cough. Moving on, the second most common cause after infections are the reactive airway diseases. Now, the name itself suggests what the condition is. A reactive airway disease is a condition where a patient's airway reacts to certain irritants which can be internal or external, which is why we have allergic conditions included under reactive airway diseases. So what happens is, if a patient comes to us where cough is the only complaint, but the patient meets the criteria for asthma, that is, there is bronchial hyperresponsiveness and reversibility present, we term this condition as cough variant asthma. Now, this is particularly very common in asthmatics. The patient may or may not know that he has asthma, will only complain of cough. There will be mild or no breathlessness associated with the cough. Now, moving on, we have two other very common conditions similar to asthma which can cause cough. We have atopic cough and we have eosinophilic bronchitis. Atopic cough occurs in individuals with a family history of atopy, and we find abundant eosinophils in the sputum when we go ahead with investigations, but there is normal airway function and responsiveness. So we see that along with the symptoms, it is also important to investigate a cough so that we can differentiate between diagnosis, especially in cases that have similar symptoms or confusing symptoms. Now, moving on, within reactive airway diseases, we have asthma, which is the most common cause of chronic cough, as we just discussed, and it is seen in both adults as well as children. Now, coughing may either be the only symptom present, or the other symptoms of asthma can be present, like wheezing, shortness of breath, a tight or a constriction sort of a feeling in the chest. So, when we treat the asthma, the cough usually subsides. The next and the most common condition is chronic bronchitis, which is again seen in a lot of people. It is defined as a persistent cough that produces sputum and mucus for at least 3 months in 2 consecutive years. Now, chronic bronchitis is also the most common cause of smoker's cough. So, if a patient is coming to us and saying that he has a history of long standing cough, which is productive, which happens at least 2 to 3 times in a year, and if he is also a smoker, we must consider chronic bronchitis as one of the possibilities. Now, why does smoking lead to cough? Tobacco causes inflammation, secretion of mucus into the airway, and difficulty in clearing that mucus out of the airways. Now, cough acts as a reflex which helps in clearing out these secretions. We have to ask the patient, obviously, to quit smoking, otherwise, the cough is not going to go away. Lastly, this type of cough can also be seen in conditions like pneumoconiosis or long term fume inhalation. So, again, when we are investigating a case of cough, we have to know the profession of the patient. If the patient is involved in some form of chemical industry, or the patient is working in a place where he is exposed to a lot of irritants like sawdust, paper dust, or is surrounded by artificial dyes, colors, or fragrances that can irritate the airways and cause cough. So, we've discussed the two most common respiratory causes of cough, which was infection and reactive airway diseases, under which obviously we have a lot of diagnoses that are present, and we can differentiate it depending upon the clinical picture. Now, moving on to the non respiratory causes of cough. Amongst them, the most common cause is gastroesophageal reflux. In people with unexplained cough, we must think of gastroesophageal reflux disease. Now, this occurs when the acidic contents from the stomach are thrown back up into the esophagus. This leads to irritation and subsequent cough. Sometimes, in cases where the symptoms of cough cannot be associated with any underlying illness, where the patient is just giving non-specific symptoms of cough that comes in at any time during the day, we do not find any significant examination findings, we must think of gastroesophageal reflux disease as a causation. Occasionally, the patient may describe symptoms of acidity, heartburn, or indigestion, but often the patients do not correlate these symptoms together. So while we are taking the case, we must ask the patient if he has any other associated symptom present. Now, GERD can also aggravate underlying conditions like asthma or bronchitis. Next, we have foreign body. Now, we must think of this especially in a child who comes to us with sudden coughing, difficulty in breathing, or even stridor. Kids generally ingest certain foreign bodies like coins or peanuts or say erasers, which get dislodged into the trachea and may lead to symptoms of cough. Obviously, while we are examining the patient, we also have to ask the mother or the caretaker with the child if the child ate something or was playing with something, especially when they tell us that he was absolutely fine, there was no problem, and then suddenly he started getting breathless and getting cough. Rarely the sutures left behind in the airways after a surgical procedure can also act as a foreign body and lead to irritation of the airways, which can cause cough. A cough can also be triggered because of dryness of the airways. Now, this is very common in people who have a problem of mouth breathing or recurrent aspiration of food into the windpipe in people with swallowing difficulty. So now mouth breathing is common in people who have nose block, who have upper respiratory airway block, which could be because of rhinitis, sinusitis, adenoids. And sometimes what happens also is when we are eating food, we accidentally talk or inhale while eating food, and the food gets dislodged into the airways or the windpipe. This is going to irritate the airways and lead to cough. Now, after foreign bodies, the next common cause is perhaps an iatrogenic cause or a cause of cough that is caused by certain medications. The most common cause of iatrogenic cough are ACE inhibitors or angiotensin converting enzyme inhibitors. Now, these drugs are used in allopathy and are very commonly used in heart conditions, in diabetes, and in high blood pressure. Now, again, these three conditions are very common in people, and often we see when the patient comes to us, he is already on certain medications for their heart troubles or blood pressure issues or diabetes and have been taking them for years. So we have to also consider a possibility of iatrogenic cough in a patient who is prescribed angiotensin converting enzyme inhibitors. And in such cases, the only way the cough is going to get cured or subside is when we stop these medications. Now, some of the medications that are commonly used in hypertension are ramipril and quinapril. Now, these are the cases that are usually labeled as cough of unknown origin, and it is seen that there is resolution of the cough once we stop the drug. Now, we were discussing the physical causes of cough. Sometimes a mental condition or a psychological condition can also lead to cough. This type of cough is present as psychogenic cough. A psychogenic cough could be a habit cough or a tick cough, and It can be considered as a cause when there is no evident physical problem present in the patient. In these instances, we have to suspect of certain emotional and psychological problems in a patient. Now remember, if you are diagnosing psychogenic cough in a patient, you must be sure that there is no other cause of cough that is present in a patient. So you have to take the case thoroughly, you have to examine the patient, you have to carry out investigations. And even after that, if you do not find any physical cause, maybe then you can think of psychogenic cough as the cause. Psychogenic cough is more common in children than in adults, and it is usually seen in a child who has a chronically ill brother or sister in the family. So the child constantly sees someone sick in the family, probably is not getting enough attention because all the attention is given to the sibling who's unwell. In such cases, kids can come up with cough, which could be voluntary or a involuntary reaction of their body. Next, we have something called as sensory neurogenic cough. Some cases of chronic cough can be attributed to a sensory neurogenic disorder. A person with SNC may cough dozens to hundreds of times per day, often may wake up at night because of the cough. A few of these coughing attacks may become violent and last for 30 seconds to several minutes. Now, usually the patient says that the attack begins with an abrupt sensation in the throat, which could be like a tickling sensation or a sudden dry patch felt in the throat, or if the patient has inhaled something powdered and has irritation from that substance, if there is some mucus dripping in the throat or something else. So these are certain sensations that a patient may feel trigger the cough. Again, if you see for us, these are very characteristic sensations because we usually consider these symptoms while we think of a remedy. But again, to diagnose a patient with sensory neurogenic cough, you have to be sure that there is no other cause present. Next, and the most important, are the cardiovascular causes. Now, when we are examining a patient of cough or taking the history of a patient who has cough, we must also ask questions or examine the cardiovascular system so as to rule out any probable cardiovascular cause. Because usually certain cardiovascular symptoms are masked and present as cough. We keep treating the patient but miss out on certain subtle signs that the patient's body must be showing or certain symptoms that the patient says, but we do not take it as important. Cardiovascular causes are generally serious and therefore we must rule them out when we are investigating a cause of long standing cough, especially in old people or in people with a history of heart disease. We must be very careful to rule out a cardiovascular cause. Cardiovascular diseases associated with cough are heart failure, pulmonary infarction, and aortic aneurysm. Typically, nocturnal cough is associated with heart failure as the heart does not compensate for the increased volume shift to the pulmonary circulation, in turn causing pulmonary edema, and resultant cough. Now, we've discussed all common causes which are respiratory, non-respiratory. Let us have a look at some uncommon causes of cough which can be present in a patient. Now, coughing may also be used for social reasons, such as coughing before giving speech. We have also seen some people have a habit of clearing their throat while they are going to address the public or say something important. So, similarly, coughing can also be a way of clearing the throat. So, this is different from habit cough or tick cough. Now, coughing can also occur in Tourette syndrome, which is a rare disorder affecting the nerves where the patient has certain repetitive actions on which he has no control over. So he makes certain sounds or keeps clearing the throat again and again, which also can be presented as repeated cough. Now, coughing can, like I just said, coughing can be used in social situations. In social situations, cough can also be used to attract attention, to release internal psychological tension, especially in a patient who gets anxious in front of new people, in front of crowds, while he is going to address a crowd. Coughing acts as a release of psychological tension. Or repeated actions of this sort can also become a maladaptive displacement behavior. It is believed that the frequency of such coughing increases in environments vulnerable to psychological tension and social conflict. So, obviously, the patient might give us some hint as to, say, he gets cough in presence of strangers, which if you think is an important symptom of our materia medica. We have remedies which cover this symptom, and maybe cough before addressing a crowd, cough before giving a speech. In such environments, coughing may become as one of many displacement behaviors, or simply put, a defense mechanism on the part of the patient. Now we've discussed the classification of cough, common causes of cough. There is another way through which we can study cough. It is by looking at the site of origin of cough, then thinking about what could be the common cause at that location and what could be the clinical features. Now, a cough that originates from pharynx is most commonly caused because of a post-nasal drip. A post-nasal drip is commonly present in chronic rhinitis. It could also be present in sinusitis, or say a deviated nasal septum, or any condition which makes the patient sneeze constantly. There is constant sneezing, nose running, nose block. Post nasal drip can occur. If the cough is originating from larynx, we can think of laryngitis, which is again very common. We can think of neoplasms, which can be both benign or malignant. We can think of whooping cough or croup. In a patient with laryngitis or laryngeal involvement, the voice is altered, obviously. There will be harsh or painful cough, and it is often associated with stridor. Moving down, coming to the trachea. Tracheal causes of cough are tracheitis, which could be because of inflammation, infection, or irritation. The clinical features would be raw retrosternal pain with cough. Now, as homeopaths, we can also think of certain remedies associated with this sort of a symptom. Moving further down, coming to the bronchi, we have bronchitis, we have COPD, we have asthma, we have eosinophilic bronchitis, and a rare yet significant cause is bronchial carcinoma. In such cases, the patient may tell us that he has dry or productive cough which is worse in the mornings and again at night, but usually at night the cough is dry. The signs and symptoms could be similar to asthma in cases of airway hyperreactivity. In cases of bronchial carcinoma, you will have other associated symptoms present with the case. The patient can also have persistent hemoptysis. Now, in a case which has cough and hemoptysis, we must investigate thoroughly because sometimes, as I just said, a carcinoma could be the cause of persistent hemoptysis from the lungs. Next, we move to the lung parenchyma. Now, lung parenchyma involvement is seen in tuberculosis, in pneumonia, in bronchiectasis, in pulmonary edema, and in interstitial fibrosis. Again, there can be a lot of other conditions associated with these sites of origin, but I have mentioned the most common ones so that we get a thorough understanding and do not miss out on the very common things that we see during practice. Now, depending upon the causes, the cough is usually productive with hemoptysis. The cough could be dry initially and productive later. The patient will tell us that his expectoration is worse or the cough is worse when he changes the posture. The cough is often at night, which is nocturnal cough, and can be associated with pink frothy sputum. Now, pink frothy sputum could be because of a lot of conditions, but is most common in pulmonary edema. So, if a patient is telling you that he has nocturnal cough and has sputum that is pink and frothy, you must think of a cardiovascular cause, particularly pulmonary edema. Lastly, the cough can be just dry, very irritating, and distressing. So, now we just summarized cough in another way where we thought of the location, where we addressed the probable causes or the diagnosis present at that location and the clinical features. Now we move on to the diagnostic approach. Again, when we are taking a case of cough, we must ascertain the location of the cough, whether it is a respiratory cough or a cardiac cough. Depending on that, we move on towards a diagnosis. Now, the determination of the cause of cough usually begins by determining if it is specific or non-specific in nature. A specific cough is associated with other symptoms, and then our further workup will be dependent on the symptoms that the patient is giving us. While a non-specific cough, where we do not get a clear picture, where we cannot find the site of origin of the cough, we have to think of a number of investigations and a diagnosis. So, our further approach will obviously be to investigate the case, wherein we can do certain blood tests, wherein we can do x-rays and spirometry. Now, blood tests are used in differentiating between infectious cough or allergic cough, wherein in infections we will have elevated WBC counts. The differential WBC count helps us in understanding if what type of infection is it, if it is a common infection or if it could be a tuberculosis sort of an infection. Um, we can identify allergies by the number of eosinophils present in the blood. We can also do a test particularly for allergies where we measure the serum IgE levels in the patient. Um, we can also do certain specific tests like sputum examination, wherein we find the bacteria or the presence of cells in the sputum, which can help us in arriving at a diagnosis. X-rays are useful in cases where we suspect a lower respiratory tract involvement. It can help us in diagnosing chronic bronchitis, tuberculosis, bronchiectasis. We can also identify if there is a neoplasm present in the chest. Lastly, spirometry or lung function tests are used in reactive airway diseases to determine the lung capacity and various parameters that help us in assessing the severity of the disease or the extent to which the lungs of the patient are affected. Now, moving on to some homeopathic remedies for cough. If you see the repertory with just the rubric cough, there are more than 900 remedies that are present with under just the rubric cough. So this is a good thing that in our materia medica we have so many remedies that cover cough. But here I have listed some very common remedies that you and I use in cases of cough. I have differentiated them according to the type of cough. Now, again, some of these remedies may have both, but generally, for dry cough, we can think of aconite, we can think of belladonna, bryonia, phosphorus, causticum, spongia, and rumex. Similarly, if the patient has productive cough or there is expectoration, we can think of Drosera, Heparsulf, Calibichrome, Stannum met, Antim tart, Arsenic album, and Pulsatilla. Now, as we know, each remedy has a characteristic causation, characteristic symptoms on which we differentiate them, and characteristic modalities present. We usually, the most common way of learning the remedy of in relation to a particular condition is referring the materia medica. You can go back to your textbooks and read cough or the remedy in general to get an idea of when can we think of the remedy. But today I am going to tell you an interesting way of learning a remedy, which is using the repertory. Now, why is it better in certain ways? We know that every textbook of materia medica has a certain theme or a speciality. Like some textbooks give the entire drug picture with more emphasis on the generals and the mind. Some textbooks, like the clinical ones, like say Boric, give emphasis only on the particulars of the patient. So, if I want to get an idea of the entire remedy, as to how this remedy is represented in cases of cough, the best way is to study it through repertory. So let us have a look of how can we learn a remedy through repertory. So we take up say causticum from the dry cough section, and we will now find what are the symptoms of cough present in causticum. To do that, we can use something called as the remedy extract feature. It is present under the Remedy tab. When we click on it, a drop down opens in which the second option is the one that we are going to use today. So let us see what a remedy extract is. When you click on it, you see on your left hand side various options like add repertories or chapters, include certain keywords. You have the extract options where you can include all the rubrics or certain particular PQRS rubrics. You have an option to include remedy with marks from 1 mark to 5 marks, and you have an option to include rubrics with levels, again from second level to fifth level. We can choose what we want to include and what we want to discard. So let us study causticum through this. Here in the add remedy box, I am going to select causticum. You can type it in the search bar or scroll down to search and click on the remedy. To search causticum, I will type the first 3 alphabets of causticum, and you can see it is the second suggestion present. I will select the box. Now, using this feature, you can also compare two remedies in with regards to a particular condition or say a particular system. Say right now we are considering cough, but if suppose you want to compare the respiratory symptoms of causticum with any other remedy, you can select two remedies in this. But we are now going ahead with just causticum. So we've selected it and we click on add. You can now see causticum is reflecting under the add remedy option. Moving on, we can add the repertories in general or a particular chapter from the repertory. So here you can see complete repertory opens by default. You can minimize it and you can see other repertories that are present in the software. So you can either select the repertory in general. Suppose you want to say learn the representation of a remedy in a particular repertory. So you can just select the entire repertory in general. But here I am looking particularly for cough, and I will look at cough from the complete repertory as it has the maximum number of rubrics and remedies listed for cough. So we will type cough and you can see it is already reflecting in our search results. We will select cough and after that we click on done. Again our selection complete repertory, the cough chapter is reflecting. Here you can include certain symptom keywords, like if in cough I just want to read about say dry cough or wet cough. Here is where I can type that keyword. But let us keep it overall. Let us have a look at the representation of causticum in cough. Moving down, we will select all rubrics, which is selected by default, and we wish to include all drug marks and all the rubric levels. After we are done with this selection, I will click on extract, and now you can see there are 229 rubrics of causticum that are present in the complete repertory. So these rubrics are not just related to the physical symptoms. These are the aggravating and ameliorating modalities. These contain the concomitants, both mental and physical. These will contain our characteristic sensations. These rubrics will have the physical general manifestations. And lastly, the causation if present. So here we can see there are 229 rubrics. Now every rubric color relates to the level of the rubric, and the column in the center is the mark of the remedy in the rubric. So say for example, in cough aggravated at daytime, causticum is a 3-mark remedy. And the last column has the total number of remedies which have this symptom, and out of which causticum is one of the remedy. So like the first symptom, cough aggravated daytime, we have 135 remedies which has this symptom, and causticum is one of the 3-mark remedies. Moving on, we can see symptoms like cough aggravated in the morning on rising. We have cough aggravated in the evening. We have cough until midnight. We have, say, cough only at night. We have cough aggravated in coryza. So again, here you can see some rubrics are big with a lot of remedies, and some rubrics have just a few remedies, like 6 or 7, out of which causticum is one of the remedies. So this gives us a general idea of the rubrics that causticum covers. Now, if I want to know some very specific rubrics to causticum, through which I know that this patient needs causticum, through which I can be sure of causticum at the remedy, I can select single remedy rubrics in the extract option. Here, the search results will now reflect only the rubrics containing causticum as a single remedy. So let us click on extract and see how many rubrics do we have. Okay, so we just have 3 rubrics that are very specific to causticum, that are not present in any other remedy. Those are cough, hissing, voice with loss of. So there is loss of voice with hissing sounds. The patient has hissing sound while talking, and there is cough. The next one, we have cough, racking, morning, waking on, and we have cough, talking before, where causticum is again the only remedy listed. So in this way, we saw that causticum has a very huge representation when it comes to cough, but only 3 specific rubrics where it is the only remedy indicated. Next, let us take up, say, Drosera, which was one of the remedies that we listed under productive cough. So again, to study Drosera, first I will remove causticum from my selection, and instead of causticum, I now type Drosera and click on it to select it, and then click on add. Here again I want to read the symptoms or rubrics of Drosera present in the complete repertory under the chapter of cough. First, let us have a look at all the rubrics of Drosera, covering all drug marks and all rubric levels. We click on extract, and now we can see that there are 256 rubrics that have Drosera as a remedy listed under them. Some of them again have a lot of remedies, some have just a few remedies. Say for symptoms like cough, evening, aggravation, bed in, head touches the pillow as soon as, there are only 2 remedies, and out of which one of them is Drosera. Now you can also click on the rubric to see what all remedies are indicated under the rubric. We move further down and we have a look at some other symptoms like cough, night aggravation, tuberculosis of lungs in, cough, night aggravation, waking on, cough midnight about. We have a time modality, cough midnight after 2 a.m. about or 3 a.m. about. So here you can scroll down and read the rubrics in order to make a picture of Drosera and its representation in cough. Now again, let us have a look at the single remedy rubrics of Drosera. Let us see what is unique to this remedy. Okay, so Drosera has more rubrics which are single remedy in comparison to causticum. We have 14 rubrics of Drosera. So the first one is cough contracting abdomen from, cough contraction from, cough convulsions spasms after, convulsive spasmodic cough during the heat stage of the fever, cough where the patient holds the body, especially the hypochondrium, cough inability to cough because of pain and the patient puts pressure by a hand on the pit of stomach and it ameliorates the patient, which is a very interesting symptom. We have cough roughness scraping from throat in. We have sudden paroxysmal cough with retching and gagging. We have paroxysmal cough where vomiting ameliorates. Now, this is a very interesting symptom where walking, especially walking fast, ameliorates the cough. Usually, in a patient with cough, any kind of physical activity is going to aggravate the cough. But here, walking fast is making the cough better. So, you can keep this in mind as a very, very interesting symptom of Drosera. Cough at 2 a.m. that we just saw. Cough, in whooping cough, there is contraction of fingers, convulsive, spasmodic. And the last unique rubric is cough in young tuberculous patients with constant distressing night cough. So now we generally think of Drosera as a remedy, obviously in cough, which has a lot of asthmatic symptoms where the patient has cough as soon as he is lying down. But today we learned certain very specific symptoms to Drosera, wherein the patient is better by putting pressure on the hypogastrium. The patient is unable to cough because of the pain. The patient is better by walking rapidly. So, next time when you have such a patient with such symptoms, you can think of Drosera in such instances. Now, we have finished looking at what cough is, what causes cough, what are the clinical features of cough. We discussed in brief about the diagnostic approach and investigations of cough, and we saw how we can study our remedies related to cough using the repertory. Let us now have a look at a case of long standing cough. Let us correlate the symptoms to everything we have just discussed and let us find out if now we are able to arrive at the right diagnosis and form a remedy picture. I hope you have your pen and paper ready with you or your software ready so that as I describe the case, you can note down the characteristic symptoms present in the case. So let us start. This case is of a 12-year-old male child who was brought to us with the chief complaint of recurrent episodes of cough since childhood. The mother told us that the child has coughed since the past 6 to 7 years. The bouts of cough recurred at every change of weather, and every time the kid had, say, ketchups or jams, basically any food that has artificial flavoring or coloring. Now, I want you to keep this symptom in mind. The cough was dry with scanty expectoration, and there were occasional episodes where the cough was productive, wherein the expectoration was white and sticky. Along with the cough, there was also breathlessness with episodes of constriction in the chest. The child told us that he would get breathless while playing and climbing stairs. Now, breathlessness was also aggravated by change of weather and eating colored or artificially flavored foods. So, this was his chief complaint. Further, the mother added that during the episodes of breathlessness, she could hear whistling sounds coming from the chest. Now, I want you to note this symptom down too. The mother also added that the son only feels better after he takes a dose of medicine from the pump or the inhaler. And she told us that her son had to take the inhaler almost 4 to 5 times in the week. So out of 7 days, the kid was using the inhaler for 4 to 5 times, which is a lot. Now, moving on to his personal history. The child was short in height, he was overweight, and had a short neck. The mother told us that his appetite was very good and he ate well. There was no significant aggravation or amelioration from any food or drink, and we could not find any specific craving or aversion present. When we asked about thirst, the mother told us that she often has to force her son to drink water. The child was constipated. The mother mentioned that he passes stools once in 2 days, and this has always been the case. There were no complaints in urine, but when we asked about perspiration, the mother said it was very offensive and there was a lot of perspiration on the feet. Coming to sleep, she told us that he sleeps a lot. He sleeps for 10 to 12 hours and it was difficult to wake him up from the sleep. Coming to dreams, the child told us that he has dreams of daily activities like he's playing in the garden or riding his bike. Now, when we are taking a pediatric case or a case of a child who is, say, till 16 or 18 years of age, we have to consider the child development and growth in detail. One, because it can make us understand the growth of and development of the child. Two, sometimes we can arrive at a diagnosis looking at the child's history. Three, as homeopaths, we can come to know the pattern of growth of the child, the characteristics of growth in the child, and it can help us in differentiating a remedy. So, let us have a look at his development and growth. His mother told us that his birth was full term normal delivery. His birth weight was 3 kgs. Coming to the milestones, the mother was not quite sure, but she said that all the milestones were delayed. Say he started teething after 15 months, which is quite late, walking around 18 months, which generally begins by, say, 10 or 12 months of age, and talking after 2 years of age. So she could not list all the milestones, but these were the ones she specifically mentioned. He also had a history of recurrent tonsillitis. and the parents decided to do a tonsillectomy because of that. The past history, apart from the tonsillectomy, was not significant. However, coming to the family history, his father had a problem of asthma. Now, let us have a look at the examination findings in the patient. We have the pulse at 80 beats per minute, the temperature was afebrile, the respiratory rate was 12 beats per minute, there was no pallor, cyanosis, icterus, or lymphadenopathy present. Now, when we were doing the systemic examination, we did not find anything abnormal in the CVS, CNS, and the gastrointestinal tract. However, while we were examining the chest of the patient, we found that the air entry was bilaterally equal. There were bilateral scattered wheezing present in the lungs and basal crepitation present. Now, I hope you have noted down the symptoms of cough. And now, if we correlate the symptoms of cough, breathlessness, tightness in the chest with this examination finding, which is scattered wheezing and basal crepitation, we can now at least categorize this cough falling into the category of a reactive airway disease. Okay, but before moving on to the diagnosis, since the patient has given us a history of cough that is long standing, we also have to consider the mental symptoms of the patient, as a constitutional approach will only help in cure or help in reducing the symptoms in this patient. So let us have a look at the mental symptoms. The boy was an only child. He lived with his parents and grandparents. Mother told us that he still makes spelling mistakes and silly mistakes while talking and even writing. So, for a 12-year-old to make mistakes in talking and writing becomes characteristic, because this is not common for a child of his age. He takes time to learn something new or to remember something. The mother mentioned that he was very absent minded, and she also added that he gets these violent fits of anger over no rhyme or reason. But whenever he is angry, he is also afraid of people. Like, he does not want to confront anyone or fight with anyone particularly. Or if anybody comes and, yells back at him, he gets scared. So the word his mother typically used was that he is a coward. He gets angry, he yells, but when it's time to confront someone or when someone yells back at him, he gets scared. He keeps smiling when alone and mutters when alone. This is again a very important symptom, because it is not usual or common for a 12-year-old child to smile when alone or keep talking to himself when it is alone. We can see this in, say, a toddler or, say, a preschooler. They can have their own imaginary, play games where they play with themselves when they are alone. But in a 12-year-old child, this becomes a very important symptom. The mother also mentioned that he likes to sit alone or hide in corners of the house. He does not like strangers at all. He does not observe things nicely. He lacks attention and forgets even very simple things. It is very difficult to teach him anything. She also said that she gets a lot of complaints from school that the child is shy in front of his school teachers, is not shy at home, but is shy in front of school teachers. He will not talk or interact or do anything in school. And he also does not make friends easily. So now we have an idea of the life situation of the child and the mental symptoms of the child. Let us finally have a look at the diagnosis of the case. I hope when I told you to correlate the symptoms with the investigation findings, and when we discussed that this comes into the category of reactive airway diseases, you may have a brief idea of what the diagnosis could be. So, this case was diagnosed to be of asthmatic bronchitis. Asthmatic bronchitis is bronchitis that happens in asthma. These two conditions are related. Having asthma puts the patient at a risk of bronchitis. Asthma constricts the airways in the lungs, and when the airways gets inflamed, they secrete mucus. So it leads to productive cough or dry cough that is seen in bronchitis. Now, if we go back to the symptoms that the patient gave us, wherein he said that his complaints are worse at change of weather, on eating ketchups or jams or colored foods, basically, these symptoms now become a common symptom, because in asthma and in bronchitis, both, the patients are generally worse every time the weather changes, and can also have a response to these artificial food additives, that is food coloring and food flavoring. The Handymanian classification of this disease would be dynamic chronic miasmatic disease with fully developed symptoms. Let us now have a look at the totality of symptoms. We have considered absent-minded as the first symptom because it was the most marked symptom present in the mental picture. Second, we have sudden anger but with cowardness. Now, this is a complete symptom in itself. We have not taken sudden anger one as the symptom and cowardness as another symptom. Here, the mother specifically told us that he gets very angry but gets scared when it's time to confront someone or to talk to someone about the cause of the anger. Smiling when alone is again an important symptom. As I told you, it is not normal and common in a 12-year-old child. Shyness from teachers is a very specific symptom which is again characteristic. Lack of observation with weak memory is a characteristic mental intellectual symptom. Makes mistake while writing. Again, we have considered this in our totality because it is not common for a 12-year-old to make mistakes while writing. Generally, by that age, your reading and writing skills are refined and nice. So, this becomes a characteristic mental intellectual symptom. So, these were the mental symptoms that we took into consideration in our totality. Next, we have the physical general symptom, which is offensive perspiration. After this, we have taken perspiration on feet as it is a different symptom, and this makes it a characteristic physical particular symptom. Lastly, we have considered delayed milestones as an important symptom, as we saw that during case taking we came to know about certain important symptoms which were pointing towards delayed milestones. So, but even though it is a physical general, we've taken it at the end of our totality so that we can use it as a differentiating feature when we arrive at a remedy. Let us now have a look at the conversion of these symptoms into rubrics. So, absent-minded was found under the complete repertory in the mind chapter as absent-mindedness. Sudden anger but with cowardness is converted into a rubric as anger, sudden, paroxysmal, cowardice with. It is present in the mind chapter of complete repertory. Smiling when alone we find under the mind chapter of complete repertory as smiling alone being. Shy from teachers is present as timidity teachers too under the mind chapter of complete repertory. Lack of observation with weak memory was converted into a rubric as unobserving children memory with weakness of, and it is found under the mind chapter of complete repertory. Makes mistake while writing and talking is considered as mistakes making, talking in, writing while. We found this symptom under the mind chapter of complete repertory. Offensive perspiration is found as perspiration offensive in the complete repertory. Perspiration on feet is found as perspiration feet in the extremities chapter of complete repertory. Last symptom, delayed milestones, was found as development arrested in the generalities chapter of complete repertory. Now, especially when we are looking for delayed milestones, we tend to type these keywords while searching a rubrics. We have to keep this in mind that sometimes a symptom can be represented in a slightly different language. Say, development arrested is another way of saying that the milestones are delayed. So you have to think of other options while searching a rubric in case you do not find the desired rubric at the first instance. Now that we have our totality and it is converted into rubrics, it is time for us to repertorize this case. So let us begin repertorizing this case using Hompath Zomeo. So the first symptom that we wish to record is absent-minded. To search this symptom, all we have to do is press Command S and a search bar opens. Now this is a general search wherein we enter certain keywords or the symptom, and the software will show us all the results related to those particular words that we've entered in the search bar. The results will be from all the repertories, and we can select the rubric from the repertory we wish to use. So for absent minded, I will type absent minded and click on record search. So the first search result is the one that I want to use in my totality. To repertorize it or to add it to my repertory sheet, I will click on the box and the symptom is now recorded. Moving on, the next symptom, we have sudden anger with cowardice. So we will type the two most important keywords again by pressing Command S as anger, cowardice, and click on search. So the first symptom is the one that I want to include is mind, anger, sudden, paroxysmal cowardice with. Unsurprisingly, it has only one remedy. So let us click on the rubric and see what is the remedy. So Baraita carb is the only remedy which covers this symptom. Now to record this, I will again click in the box and record this rubric. Moving on, we have a symptom smiling when alone. Again, I will press Command S and type smiling alone, the two most important keywords in my symptom, and click on search. So again, I have one symptom with just one remedy present in my search result. I will select it, but let us also see what is the remedy. Again, Baraita carb is the only remedy, which is very interesting. The next symptom we have is shy from teachers or timidity from teachers. So again, I will press Command S, type timidity, teachers, the two important keywords, and click on the symptom. Here also we just have one search result from the complete repertory. We will select the symptom and record it. Now, there is another way through which you can repertorize or add a rubric to your repertory sheet, which is from the repertory list. So to open the repertory list, we click on the repertory module and select the first option, which is the repertory list. So here we have the complete repertory, which opens up by default. Now within the complete repertory, I want to search for my next symptom, that is lack of observation and weak memory. So we can also type the word we found in rubric as unobserving. To do that, I will click on this search icon present on the extreme right of my screen. This is like an internal search within the repertory. So now as you see, I will type unobserving, and the symptoms with the word unobserving are listed as the search result. But we want to select the third symptom, which is unobserving children memory with weakness of. To record it, I will click in the box, and this symptom 2 is now recorded. The next symptom we have is makes mistake while talking and writing. It is a quite long rubric. To find the rubric again, I will type the two most important keywords in the search internal repertory search that we just used. So here I type talking, writing, and we have the rubric which is mistakes making talking in writing while. This is the rubric that we are looking for. We click on it and we record it. Now if you want to have a look at the symptoms that we've just recorded and to confirm if we have the symptoms that we've recorded are present in the repertory sheet, and to see what is the remedy that is coming uh, including these symptoms, so we can click on the view repertorization option, which is present on your extreme left in the toolbar as the first option. We click on it, and now we can see our repertorization result. So here interestingly, as we saw, a lot of symptom had Baraita Kav as the only remedy, and two or three of them were the only rubrics in the repertory. So because of which till now, including the symptoms of mind, Baraita Kav is the only remedy which is covering almost all the symptoms that we've entered. Now let us see if this changes when we add our physical generals and physical particular symptoms. So the next symptom we have is perspiration offensive. To record this, I can also type it in the quick repertorization option, which is present just above your repertory sheet. Here I will type perspiration offensive. Now through this, the software will automatically select the closest rubric with the maximum number of remedies present. To record it, I will click on this arrow, and you can see that the rubric with perspiration offensive has been recorded. The next rubric we have is perspiration on the feet. So again, I will type perspiration feet. So we just remove offensive from here and add feet and click on this arrow and record the symptom. So here you can see perspiration feet from the extremities chapter has been recorded. The last symptom of our totality is development arrested. We will type these keywords in the quick repertorization option as development arrested and click on record. So again, the rubrics with maximum number of remedies and closest to our keyword, which was development arrested, has automatically been included in our repertory sheet. Now, interestingly, even after adding the physical generals and particular symptoms, we still have Baraita carb as the remedy, which is covering all the symptoms, including the mental symptoms as well as the physical symptoms. Even though there are other remedies which are covering the physical generals, but no other remedy is covering the mental picture of our patient. So we decided to go ahead with Baraita carb 200 as our prescription. We gave the patient Baraita carb 200 4 powders and SL 200 TDS for a month. We chose this remedy because the mentals and physicals of the patient were exactly being covered by the remedy. Now, coming to the follow up, the potency was gradually increased from 200 to 1 m, and after a period of a year and a half, the patient was completely better. There were no episodes of cough or breathlessness. The patient had stopped using inhalers within the first 2 months of treatment. His mother also told us that his bouts of anger had reduced, and even the teachers mentioned that he was paying more attention in class and was better in his school performance. So now you see, our remedy that we prescribed for cough did not just resolve the issues related with cough, but also caused an overall improvement in the patient. His behavior was better, his school performance was better. So, which means that a correct remedy can cause a lot of relief to your patient on all levels. So, what did we learn from today's session? We learnt about the types of cough, the causes of cough, the correlation of the symptoms of cough to a diagnosis. We learnt how can we study a remedy using the repertory for a particular condition, and we also understood why it is a better way, because there is better representation of the remedy, and we are sure that we are not missing out on any symptom in relation to the condition that we wish to know the remedy. Lastly, with the case, we learned the importance of taking the developmental history in a child. Why is it important in pediatric case records? We also understood the importance of considering the entire totality along with the developmental symptoms. So if the patient comes with cough and if it is a long standing case, it is very important to consider the entire symptom picture, including the mind, the physical generals. Only then will we be able to cure or give long term permanent relief to the patient. So that is all for today. I hope you enjoyed this session as much as I did. I will see you again with an interesting topic next